I'm Dr. Robin Lewis. I am a naturopathic physician practicing in Vancouver, British Columbia, Canada. And today I want to talk to you about how your gut is related to your cardiovascular system. Now, this is often referred to as our gut-heart axis, and it is referring to the profound effect that your gut health has on the health of your heart, your blood vessels, your cholesterol, your blood pressure, your sugars, and so on. And I find this topic incredibly important because a lot of people feel helpless when it comes to their cardiovascular diseases, because often the only solutions being offered to them are pharmaceutical therapies. But what most people don't realize is your cardiovascular system is a reflection of your overall health and certainly your gut health. So if you have heart disease that runs in your family, or you already have some of these cardiovascular risk factors, you may want to take a look at the health of your gut because it heavily influences the health of our cardiovascular system. Today you will learn how those same things that are creating bloating, loose stools, constipation, belly aches, and so on are also creating a ton of systemic inflammation that is damaging your cardiovascular system and leading to things like heart attack and stroke. I'm going to break it down into stages for you. So the first thing that I'm going to cover is how we are damaging our guts and eventually leading to poor absorption of those vital nutrients that our cardiovascular system needs to do all of the repair. I will then start talking about the gut microbiome, and this is where the majority of the research lies. How these different bugs, which I will elaborate more on later, are releasing compounds that get into your circulation and again are inflaming and damaging our cardiovascular system. Lastly, I hope that along the way I can provide some context, right? So all of the different things that can create these gut issues so that you can identify the problem, get help, or better yet, prevent these things from occurring in the first place. Now, with that in mind, let's jump in. Let's start by talking about the fundamentals of good digestion, because this is not only going to affect how we absorb those key nutrients, but also it's going to influence the health of our gut microbiome, which is what I'm going to talk about next. So if we think about core fundamentals of good digestion, we got to start by talking about all the different digestive juices we produce. These are the enzymes and acids that are released by our mouth, our stomach, our pancreas, our gallbladder, and ultimately all of these things will dump mostly into the small intestine where the majority of digestion takes place. Now, if we underproduce these digestive juices, these enzymes and acids, it can create a lot of issues. And what most people don't realize is the underproduction of these enzymes and acids is actually very common. And over time, this is going to take a massive toll on our cardiovascular system. So you can think about it this way. We are exposed to a ton of things that damage things like our blood vessel walls and our heart. This could be things like pollution or other contaminants. It could be reactive oxygen species just from general metabolism that we produce. It could be issues with our immune system, inflammation, autoimmune diseases. There are a ton of things that will create damage inside our cardiovascular system, and that damage needs to be combated with things like antioxidants, other vitamins and minerals that are crucial for the repair of our blood vessel walls. And if this damage goes unrepaired, it will lead to advanced plaque formation, which ultimately is what leads to heart attacks and strokes. So of course, if we can absorb those antioxidants, those vitamins, those minerals that are crucial in this process of combating the damage, then that's going to help a lot. That's going to slow the progression of those plaques and ultimately improve the health of our overall cardiovascular system. Now, if we start to look into some of the potential causes for why you're not absorbing and breaking down your food appropriately, it will become very clear why these issues are so common. You'll probably be able to relate to a few of these. First one would be hypochlorhydria and pancreatic insufficiency. So hypochlorhydria is referring to the underproduction of your stomach acid, and the pancreatic insufficiency is referring to the underproduction of your pancreatic enzymes. Now, the extreme versions of these conditions are rare, but the lesser extreme versions are actually quite common. So for example, your stomach acid can be dampened by things like stress, sleep deprivation, even simple aging can reduce your stomach acid production. They found that 30% of elderly people have low stomach acid. And of course, this is very important because also the elderly are who are more likely to have things like heart attacks and strokes. And so that's just one risk factor. Is just simple aging will reduce your ability to break down your foods. And certainly anything that further perpetuates that can also be a problem. And this is because a lot of our key nutrients require adequate stomach acid production. The most obvious being protein, which obviously is very important for our overall health, but even some of our things like our iron, our copper, our calcium, our magnesium, our B12 are heavily influenced by having enough stomach acid. So if you don't have enough stomach acid, you can see a whole wide variety of deficiencies starting to arise. And I could do an entire episode on those nutrients alone and how important they are for maintaining a healthy cardiovascular system. But of course, we're not going to do that today. That's just one example of why we should care about low stomach acid. The other thing that is important to note is there's a lot of medications that will also dampen the production of those enzymes and those acids. So one of the most obvious things being acid suppressing therapies that are given in the context of reflux a lot of the time. So something like pantoprazole is an acid suppressing therapy that will, yes, stop you from feeling your heartburn, but also reduce your stomach acid, which can have other downstream consequences. In fact, I always have to kind of stop myself from going on a little bit of a side tangent about that medication alone. A lot of people are on it for way too long. It is not meant to be a lifelong medication, yet I see a ton of my patients coming in on that medication for a very long time. So that's just one. Another really common medication that will negatively impact this is NSAIDs. So these are referring to things like aspirin, which will thin the lining of your gut, which is definitely going to affect absorption and also affect how well we produce some of those enzymes, which are done in that lining. So again, how many people do you know who are overusing aspirin? How many people do you know who are on acid suppressing therapies? That's just one tiny part of the puzzle. Another common thing that I see heavily influencing someone's digestion is your gallbladder and the removal of your gallbladder. A lot of people, especially in the older demographic, have had their gallbladders removed due to complications with the gallbladder, but that is where we store, concentrate, and release a lot of our bile acids. And bile will affect the acidity of your gut environment, same with stomach acid, which has a downstream impact on our microbiome for sure, but it is also how we break down fat. Bile is one of the main ways we break down and absorb fat. And so people without gallbladders have a reduced capacity to break down and absorb their fat and their fat-soluble nutrients, which are very important for cardiovascular disease. I did an entire episode, in fact, just on the importance of fat for the heart. It's one of those categories of food that plays a huge role, and having the ability to absorb it and certainly the fat-soluble vitamins that come along with it is very important. And so it's not surprising that when they studied this, they found that it has a consequence on your cardiovascular health. They looked at a study of about 800 people with their gallbladders removed, and they did indeed find that they had elevated cardiovascular risk factors like insulin resistance, hypertension, and high cholesterol. The rates of those things went up if the gallbladder was removed. So this, again, is just another common thing that I see affecting people's ability to digest these nutrients and consequentially having a negative impact on our cardiovascular health. Then, of course, we can start to look at the conditions of the gut. So things like irritable bowel disease or celiac disease, they create a ton of destruction and inflammation inside the gut that does lead to more severe manifestations of malnourishment. So these people very commonly are overtly malnourished because they have a very extreme version of poor absorption. And this then kind of leads me to my next point, which even if you don't have those diseases, those big inflammatory, big destructive diseases, you can still get something called leaky gut. Now, leaky gut gets a lot of flack online, but essentially it's referring to the loss of structural integrity inside the gastrointestinal system. So things like celiac disease create a very extreme version of it, but things like stress, poor sleep, too little exercise, too much exercise, a poor diet, all of these sort of things, a bad gut microbiome, they can lead to a lesser degree of leaky gut. And that too is going to affect your ability to absorb nutrients. And it's also going to lead to a lot of inflammation because our gut is supposed to be a tight barrier between what we eat or our microbiome and our bloodstream. We want a good barrier. We don't want to let everything into our bloodstream. And so when that barrier is becoming compromised, you can start to let in a lot more things that create a lot more damage that in an optimal environment wouldn't be allowed in. So improving the structural integrity of the gut is also very important here. And then this is going to really make a lot more sense when I talk about some of the microbiome things and how the microbiome can release a lot of these compounds that you do not want in your circulation. So the last thing that I want to mention before I dive into the gut microbiome is how these digestive enzymes and acids are also affecting the acidity and the environment of our gut, because this is really going to lend itself to the microbiome issues. If our gut environment is a slightly more acidic or a slightly more basic environment, that will promote different bugs to grow. And so when we start playing around with the acidity of the gut environment, you're going to promote the growth of good bugs or bad bugs. And so this is, again, another thing that we have to think about. Stomach acid, yes, very important for the absorption of a lot of different nutrients, but also very important to promote the growth of certain bacteria over other bacteria. And this is where the whole situation starts to get really complex. You don't really want to address one thing without the other. You can't really fix the microbiome without fixing the gut environment, and vice versa. And so I just wanted to highlight that for you guys. And this is really why I've broken this entire episode into two key components: the functions of the gut themselves and the microbiome, because both interplay a lot with each other. So with that in mind, let's talk about how your gut microbiome is influencing your cardiovascular system. The first thing I should do, though, is define the microbiome for you. So this is referring to the different bacteria, viruses, parasite, and yeast that live inside of your gut. Now, your gut is not the only place that has a microbiome. Your skin has it, your vagina has it. A lot of other areas have a microbiome as well. But to put this into context, our microbiomes, so all of these different organisms, outnumber the number of cells, the number of human cells you have, 10 to 1. So there are 10 times more of them than there are of you. So it is not surprising that they play a huge role in our overall health. There are trillions of different organisms that exist, and depending on which ones you have, they can release compounds that are beneficial for our cardiovascular system or that are detrimental to our cardiovascular system. So for example, these are called endotoxins. The same way that we absorb nutrients is the same way that we can absorb the toxins or the chemicals that these bacteria, parasites, and so forth release. And so when we refer to the endotoxins, these are toxic compounds that these different organisms release that can get into our systemic circulation and create some problems. One term for this that you may see in the research is called metabolic endotoxemia, and it is highly correlated with cardiovascular disease. Part of this is because the mainstay characteristics of metabolic endotoxemia is insulin resistance and low-grade inflammation, both of which are very well known causes of cardiovascular disease. And so this is generally referring to endotoxins. If we get a little bit more specific, one of those types of endotoxins is something called lipopolysaccharides. Now, these are part of the outer membrane of certain bacteria. And when they get into circulation, they can create a ton of problems. One of which is they are very damaging to our mitochondria, which is the part of our cells that makes energy. And if you don't understand how important the mitochondria is for cardiovascular health, please go back and watch my episode on the mitochondria health. It's called Tired, Optimize Your Mitochondria for More Energy. But there I also highlight the importance of mitochondria for cardiovascular disease, because your heart, for example, is a very energy hungry organ. It needs to pump liters and liters of blood every single minute, and that is a very energy demanding thing to do. And so it relies heavily on your mitochondria. So this LPS, or lipopolysaccharide, is very damaging to those mitochondria. And that is going to lead to a lot of oxidative stress inside the body. And oxidative stress is referring to the imbalance of free radicals to antioxidants. We obviously need to have enough antioxidants to counteract those free radicals. Otherwise, it creates a ton of damage in our blood vessel walls and in our heart. And in fact, plaque cannot form without some level of oxidative stress. So this is, again, another way your microbiome is affecting the health of your cardiovascular system. Now, of course, if you have a lot of these bad bacteria that produce a lot of this LPS, and you also have a little bit of a leaky gut picture where you're allowing a lot more of those products to get into your circulation, these things can start to escalate really quickly. So that is just one piece of the puzzle. There are a lot of other examples of specific strains and the compounds that they release being linked to cardiovascular disease, heart attacks, and strokes. But if we look at things more broadly, they have also found that just an overall low diversity and lack of richness inside the microbiome has also been linked to cardiovascular disease. So low diversity and richness of the microbiome has been linked to inflammation, insulin resistance, diabetes, hypertension, high cholesterol, among many other things. And there are a lot of things that we do and are exposed to that reduce the diversity and richness of our microbiome. For example, this can start as far back as birth. Whether or not you were a C-section baby, whether or not you were breastfed, were you exposed to animals and pets growing up? Who were the other humans in your life that you were exposed to? Have you taken many rounds of antibiotics and some of these other medications that can wipe out your microbiome? There are so many different things that we're exposed to, whether they're in our control or not, that reduce the diversity of our gut microbiome. So this is another area that you could focus on when it comes to improving the health of your microbiome. How do we add richness and diversity back into the microbiome where it may be lacking to begin with? The last thing that I want to bring up is the production of a very specific beneficial compound called short-chain fatty acids. So this compound is a product of bacterial fermentation. So in a lot of ways, what you eat, they eat. And so certain bacteria, as a part of their metabolism of things like fiber and certain amino acids in protein, they'll consume those things once you eat them and produce short-chain fatty acids that have been linked to beneficial outcomes when it comes to cardiovascular disease. For example, one study that I looked at was assessing the short-chain fatty acid butyrate in people with advanced atherosclerosis. And they found that the butyrate levels had a negative correlation with our inflammatory marker CRP, C-reactive protein. So they found that the higher the butyrate, the lower the CRP. And CRP is a marker of inflammation. So the lower the inflammation inside the body. And cardiovascular disease is an incredibly inflammatory driven process. And so anything we can do to lower inflammation is going to be of benefit. So this is an example of a compound that good bacteria can produce inside of your body that will help, that will be of benefit to your cardiovascular system. Now, these are just a few examples of how your microbiome is influencing your cardiovascular system. The amount of research that is continuing to come out on this is huge. It's a very big area of research right now. And so there is so much more to be discovered, so much more to be discussed, but I really hope this just plants the seed of the fact that your gut health is very related to your cardiovascular system. In medicine, we love to section off systems of the body as if they're separate entities, but in my training and in my belief, everything is connected, and your gut health is a very obvious connection to your cardiovascular health. And what I discussed today is only scratching the surface of all the different ways I could emphasize that point. I hope you found today helpful. If any questions came up, please let me know. And thanks again for watching.